And joining us now to talk about all this and more, Dr. Doris Day, Assistant Clinical Professor at NYU Medical Center. Lovely to see you today.
Yeah.
You look lovely as usual.
Nice.
So this is really encouraging. What are your thoughts on this green skincare? Is there something to it, or is this more marketing?
I'm not entirely sold on it yet, but I do think that there is something to it. We just need more science. When I have a patient who is allergic to sulfa in the medication that I give them, then I would be very careful not to use topicals that contain sulfa. So if you have a true food allergy, if you have a gluten allergy or sensitivity, then it does make sense to look for products that may be gluten-free, because that may be something you're reacting to. If it's in the lipstick, you eat some of that, so even a little bit can be a problem. So it does matter. But when it comes to words like organic and natural in skincare,
what do you think of that?
I think that's often a gimmick that makes it so that you can price it higher. Organic in food has come very far in terms of what the label means and what the product means. In skincare, it's still very broad, and it's still really not clear what it means. The initial ingredient may be organic, but then the product goes through a lot of processing.
Right.
And it's not organic anymore now, it's just another product. So I look more for science. If it's been tested, if it has efficacy, if it has safety, and all these products are allergy tested very broadly before they're brought to market. So I look for that, and then I look for the cost. Is it worth what it costs?
Yeah, but there's still a lot of confusion, because people wonder, is this really better? I mean, can I believe this? Because, tomorrow they're going to say that, no, this is better. And that's what makes it very difficult to choose the right thing for yourself. So how do you tailor it? I mean, you said you have to know what your health conditions are, what you're allergic to. That's important. You have to factor that in.
And sometimes you can be tested. We do patch testing for ingredients all the time. If you're having a problem with skincare products and you have a true allergy, you can be tested. And so you'll know that you need to avoid it. But people talk about parabens as if they're the worst thing for the skin.
Yeah.
But you know what? When they take parabens out, they're replacing it with something else.
Really?
And you don't know that that other thing is any better for you.
So you don't get excited when it says no parabens and all that?
What are you getting instead? You need some preservative. And sometimes preservatives can have benefits. So
parabens are not the devil?
They're not. They are not the devil. And most people don't react to them. But if you are allergic, then you need to know, and you need to avoid it.
You need a good doctor who tells you the straight stuff.
And I'm an ingredient and product junkie. I look for science.
Yes, that's why we love you. Okay, so let's talk about something else. It's allergy season for one. It's also starting to get cooler.
Yes.
And, a lot of people notice that their skin starts to change. It gets drier, redder, easily irritated. Is there something you can do ahead of time before
so
it's
much
full
you can
on?
Do. Just understand what's happening. First of all, you have the cold, dry, windy air outside, and then you walk inside and you get hit by the heat. That's also dry. So both ways, you're getting all the water pulled out of your skin. So one is put away your summer products and moisturizers, go richer, creamier, thicker. And then the shower is a real problem. You come home, you're chilled to your bones, you get in the shower, it's nice, it's hot, you stand there and let it hit and pound on your back because it feels so good. Well, I see a lot of people who come in with a rash and an itch that's intractable right in the middle of their back. And that's because they're standing in the shower too long, too hot, and the water's hitting on their back, and it creates that itch. If you have that itch, you know, and it's hard to get rid of it. So no very long hot showers, 10 to 15 minutes. When you step out, just pat your skin dry, don't rub it, and then moisturize right away, thick and creamy, and then even put on another layer of moisturizer after. Because dry, itchy skin, you scratch, you create breaks in the skin, you can get infection. Protect your skin.
So these are important things for adults, of course, but we also have to think about the little kids that are at home as well. You've got to protect their skin too.
Little kids' skin tends to be less dry than adult skin. If children have eczema or allergic, like atopy it's called, then they can be more reactive, and so you have to be more careful to moisturize more. Drinking more water is good for you in general, but it won't make the outer layers less dry. So drink more water, but you still have to moisturize.
Okay, so since you're a product junkie on that point, which I absolutely love, when you go thicker, creamier, does it really penetrate more, or is that a gimmick?
No, it actually does. It does two things. One is you look for ingredients like hyaluronic acid and lactic acid that are called humectants. They'll pull water into the skin and lock it in the skin. So you're looking for ingredients and products that will, one, pull water in the skin, and two, prevent water from escaping. And the richer the product is, the thicker it is, the less water will escape out of the skin. And then another thing people don't realize is that you still need sun protection in the winter. I hate to be the one to keep bringing it up.
That's true, though. No,
but
it's
studies show
important.
that if you use sunscreen every day all year round, instead of just sometimes, you will age better and have less skin cancers. So don't underestimate the power of those UV rays, even with incidental exposure. Even in the winter.
We like it.
You know, the other reason why we love you is because Dr. Day says you can get all the good stuff out of the drugstore.
That's
You don't
true.
have to spend a ton of money, which
And
I really
Lactin,
like.
great moisturizer, Olay, Neutrogena, great products, all different brands in your local drugstore.
All right. Dr. Doris Day, thanks for joining us, and hopefully we won't have to deal with that cold weather for a while. Right, Nick? I mean, that's
not in this next 7 days.
Put it away for a while.